So, good morning, Pam. So you're here today after I did surgery on your left foot, right?
Yes.
And you were referred by a colleague of mine from Sebring. Well, tell me, what kind of issues did you have?
I had a lot of issues.
Okay.
She did an MRI, and when I went back to see her, she told me that my foot was a mess, that I was losing cartilage in my big toe, and then I had the bunion and I had the hammer toe.
The hammer toe, right?
And she couldn't help me, and she referred me to you, which I was very happy with.
Good, good. So we decided to do a surgery, which is kind of a procedure that we've been doing for a very long time. It's a fusion of the first metatarsophalangeal joint, and we also corrected your hammer toe, of course. But we used this new plate it's not new, it's been out for about 2.5, 3 years now. It's called a max force plate, and I remember I explained it to you before the surgery. So the difference between the original surgery that we always performed and this one is we have a compression plate. So when I fuse a joint, which is kind of like two bones, right? There's a special compression mechanism that basically forces the bone to heal faster. Well, tell me about your experience. Was it a very painful procedure?
No, it wasn't. And I was surprised because even afterwards I had pain pills a couple days that I didn't have to take anything for pain.
And well, the biggest thing was you had to be off your foot, right?
Right. That was fun.
Usually. Well, unfortunately, even with the plate, the requirement for the bone to heal is you have to be off your foot for 4 weeks.
Right.
But it was not like severe pain.
No.
It was an outpatient surgical procedure, so you were home the same night. And now you're how many weeks after the surgery?
9 weeks.
9 weeks, so you're like a little bit over 2 months. Well, tell me about your progress, your level of pain. Are you satisfied? Are you happy?
Yes. Now that it was explained to me that swelling will be there for a while because I can still feel the swelling on the bottom of my toe. So
Yes, and as I told you, the swelling is the last thing.
Right.
Just take a deep breath and trust the process.
Okay.
It's foot surgery. They've published some research and they basically found out that the difference between upper extremity and lower extremity surgeries is the swelling stays in 2.5 times longer. Just because all the blood rushes down there. So swelling is normal, pain is not. So as I told you, I'm not going to give you an appointment to come back for 3 months, but if anything happens, you call me right away. You don't wait for 3 months to come in. But the most important thing is, as long as next week is better than last week and the swelling slowly subsides, and I'll give you some anti-inflammatories as well. And you have an option of also putting a compression stocking on there. But basically, you've done extremely well. I'm very proud of you. So, no, I'm very happy that it turned out that way. And I just checked your x-rays and everything looks perfect. Well, thank you for the testimony.